A coronary artery bypass graft or CABG is performed to improve circulation to the heart muscle by creating one or more alternative routes for blood to flow around blockages in the coronary arteries. To accomplish this, blood vessels from other parts of the body are grafted between the aorta and the coronary arteries. One or more coronary arteries may be bypassed during a single procedure. Before the surgery, an intravenous line will be started, and you may be given a medication to help you relax. CABG procedures are done under general anesthesia, which will put you to sleep for the duration of the operation. A breathing tube will be inserted through your mouth and into your throat to help you breathe during the operation. A catheter will be placed in your bladder to drain your urine. Coronary artery bypass surgery generally takes 3 to 6 hours. The procedure begins when your surgeon makes an incision in the skin over your breastbone, divides it, and opens the pericardium, a membrane that surrounds and protects your heart. During a conventional bypass surgery, your circulatory system will be connected to a cardiopulmonary bypass pump. This machine, which temporarily performs the functions of your heart and lungs during the surgery, allows your heart to be stopped while the surgeon sews the grafts into place. One of 2 blood vessels is usually used for the graft: the internal thoracic artery in the chest or the saphenous vein in the leg. For the internal thoracic artery graft, your surgeon will leave the upper end attached to the subclavian artery and divert the lower end from your chest wall and suture it to the narrowed coronary artery just beyond the blockage. For the saphenous vein graft, your surgeon will suture one end to the aorta and the other end to the narrowed artery just beyond the blockage. Once the grafts are securely in place, your surgeon will use electrical signals to restore the heartbeat, attach temporary pacemaker wires to the heart, and disconnect the heart-lung machine. He or she will then close the pericardium, wire the breastbone back together, and suture the incision in your chest. A drainage tube will be temporarily placed through the skin beneath the incision. 2 other types of CABG procedures have recently been developed: off-pump and minimally invasive bypass surgery. In the off-pump procedure, surgeons use a special device that stabilizes only the part of the heart the surgeon is operating on, while the rest of the heart continues to beat. Surgeons perform minimally invasive bypass procedures using specially designed instruments inserted through a small incision or port in the chest. Like the off-pump approach, minimally invasive bypass surgery can be, but is not always, performed without the use of a cardiopulmonary bypass pump. After the surgery, you will be taken to the intensive care unit, where the activity of your heart will be carefully monitored. If necessary, the pacing wires will be used to temporarily control your heart rate, and the chest tubes will remain in place to drain excess blood and air from the chest cavity. Once you can breathe independently, your breathing tube will be removed and replaced with an oxygen mask. The bladder catheter will remain in place. As you recover, all of these devices will be gradually removed over the next 3 to 4 days.